I kept having this crazy dream that I would wake up and they wouldn't have done my arms, like they would forget or something. And like I've just been talking about it, and finally I was like, okay, Aubrey, get over it, stop it. I bought a bunch of tank tops like on sale the other day. I was like, okay, it's gonna be like, this will be good. But when I signed all my paperwork today and I marked clearly, I think it hit me like, okay, this is actually happening, and I don't have any fears now. I'm just ready to go.
Awesome.
Yeah. Hi, my name is Aubrey Johansen, and I'm here today at Spectrum Aesthetics for an extended tummy tuck and a brachioplasty with Dr. Mel Ortega. So I recently have lost 160 pounds, so that's a pretty drastic weight loss, and with that weight loss comes a lot of excess skin, and I'm looking today to have the excess skin removed, which is kind of like the final step of my journey. Super exciting. And when I was getting marked earlier with Dr. Ortega, and he was saying, you should be proud of all of that skin that's left. That's a lot of hard work, and that's true. I feel extremely proud of myself to have made it here.
What are your expectations like in this whole surgery?
Just to have the excess skin gone. I was telling him, I've never been a small frame or petite or anything. I've always been overweight, so I've never really had like an ideal body in my mind.
Right.
My expectation is to feel free after this.
Yeah.
So to have, several inches of hanging skin left on your body after you've worked so hard to lose all the weight is really hard on you mentally. You know that you've made progress, but you still see so many imperfections. You just kind of wonder, when will you be proud of the work that you've done? Will it feel worth it? Will you be happy ever with your body? So I would say just eating better, cooking, being active, enjoying a balanced life has brought me here. I don't feel like I've really cut out a whole bunch of things or been on like a crash diet or anything. It was just figuring out a life of balance. So basically what I like to do is I like to count ingredients instead of counting calories.
Okay.
I'm not huge on calorie counting. I just like to know where my food is coming from, and I like to know that it's fresh and prepared. So that's my tip, honestly, and that way if you're not depriving yourself, you're not feeling like oh, I have to be so strict with this. Oh, I can't have this piece of pizza. Oh, I can't have that. And then you're more susceptible to fall off the wagon. It's just not sustainable.
Yeah. Be more realistic.
Yeah, I think being healthy is important because you love your body. It's not a punishment. You're not trying to eat better because you're mad at yourself. You want to do it to be better. 2014, I had gastric bypass surgery, and since then I've lost 160 pounds, just basically by cleaning up my eating, the tool of gastric bypass, and also exercise, just living a more active lifestyle. I exercise between 3 to 5 times a week. In the summertime, every day, because you want to be outside as much as possible. But in the winter, to schedule it into my week, it's definitely 3 to 5 times a week. And I actually prefer to lift weights. Over the treadmill. Yes, I would do it again in a heartbeat. It saved my life. Yeah, definitely. It is a tool. Weight loss surgery is just how you use it. It's as successful as you make it. Dr. Ortega's reputation is amazing, and so the fact that I could get in with him and did get in with him was incredible. I think the journey was well worth it. It's extremely affordable to come here, opposed to maybe me staying at home or traveling other places. I think this was the best bet for me. Being morbidly obese, you settle for a lot of things in your life. You feel like you don't deserve the same things that other people who are normal sized might get. You don't really take a lot of time to invest in yourself. So I think what I hope this shows other people is that you don't have to settle for anything in life. If you're not happy with the way things are, you can make a change.
Right.
It's completely up to you. How you get there is your choice. So say some people might not agree with weight loss surgery, but it was my way out of obesity. So that was the choice I made, and here I am. So if you're not happy with the choice, change it, make a different change. So I hope that people can look at this story and see, my before picture, and then I can't wait to see my after when this procedure's over, and realize you don't have to settle for anything. You don't have to settle for the skin. Don't be afraid of, I don't want to get healthy because I don't want to have excess skin. Like, there are always options. So Allie's really excited for me. We have been together for more than 4 years, and Allie loved me at my heaviest. So I think she's just really excited for me to finally see myself the way that she has always seen me.
Right.
And that's really nice. I think that's kind of a cool part of our love story, to have been through all of the changes together. So she's an athlete. She's really, really fast, and I know one of these days I'm going to beat her mile time, and it's going to make her feel really bad, and I'm going to be really excited about it. So she's definitely excited and supportive.
And how about your family?
My family is so excited as well. Yeah, they're on their way here from another part of Florida, so I can't believe the amount of love and support I've received through this process, and it's nice to be able to be so open about something, you know, which maybe other people don't want to talk about: plastic surgery, cosmetic surgery, reconstruction, weight loss, showing their skin to the world, you know. But if I could just help somebody see that it's okay, again, just make a good choice, you know, to change your life in a good way, a positive way, then I'll do it. Yeah.
Tummy tuck is probably going to hurt you more than the arms.
Okay.
Although I can't promise you that. Okay, but the most important aspect of what you want to do after this is don't lie in bed.
Okay.
Get up, move around. So that little squiggly thing that you said you had there doesn't get all congested. So mobility after these surgeries, although it's a little bit uncomfortable because there's pain involved, it's for your own safety, and you'll recover better if you walk around. You expand your lungs, you just feel better than lying around.
Okay, great.
Okay.
Awesome.
And then as far as the arms are concerned, you know, there's going to be swelling, but until your incisions are healed a little bit better, I don't want to get you into any compressive device.
Okay.
Because I don't want you to have incision healing problems, which is what those garments do at times, especially in the brachioplasty.
Right.
And the tummy is not as bad, but we're still going to put a binder on you because it's easier for dressing changes, and imagine trying to slip on a girdle with those drains in place. It's not very conducive to good wound care.
Okay, awesome.
Laxatives. Make sure you take laxatives. You will get constipated if you don't.
Okay.
The medications for pain are known to cause constipation, so don't even wait for it to happen. Start taking something. Whatever you might be used to already, use that just because of familiarity. And then by the time you've had that in a couple of days, you shouldn't have any issues.
Great.
All right?
Okay.
Any other questions?
No.
Nothing? You're all set?
I'm ready.
Excited?
Very.
You're going to be awesome.
Awesome. Thank you so much, Dr.
You're
Ortega.
Yeah. I showed you your picture.
Yeah, and I cried a little.
Yeah.
It's amazing. Better than I could have hoped.
There was a lot of fat removed. A lot. Let me show you.
It's so exciting.
This is your arms.
Okay.
This is your stomach right here.
Wow.
Yeah.
That's insane.
And look how great your body looks right
wow.
now. Look.
That's amazing.
You did awesome.
Thank you so
I'm really
much.
proud of you.
Thank you. That's amazing.
What are your thoughts right now?
I want to cry. It was so good. Oh my gosh, that's awesome. Thank you to Dr. Ortega.
On a scale from 1 to 10, how sore are you? Like, how sore do you feel?
Like right now, a 7.
A 7?
Yeah, it'll get better. I know, but
Yeah.
gotta be strong. It's tight in there. You can feel it.
Do you feel like a lot of pressure?
No, just like muscle soreness. Yeah, in the abdomen, like they hold it tight. I'm afraid I'm gonna cough and then like be in super pain. So.
Do you feel really cold?
No, I got all these wonderful blankets on me, thank God. But I would do it again already.
You don't feel dizzy or like nauseous or anything?
No dizzy, no nausea, no.